Good afternoon and welcome to our COVID-19 briefing. We know how busy you all are and we appreciate you dedicating this time to be with us this afternoon. Before we get started, we invite you to place questions or comments in the question and answer function, but to preserve time for today's speakers, we'll answer those questions after the call via email. So with that, Steve Glenn is going to start us off with today's reflection. And Steve, I'll hand it off to you.
Thank you very much, Sarah. I appreciate it. If we could center ourselves this afternoon, I will start us with this reflection. That all may know that God is love. That all may know that God is love. This year, we celebrate the 60th Jubilee of Sister Andrea Nenzel's profession of vows as a sister of St. Joseph of Peace. At the time of her vows, the Spirit spoke very clearly to Sister Andrea. Live your life that all may know that God is love. These 7 words have been a spur and an anchor for her every day of her life as a sister of St. Joseph of Peace. Her service as a CSJP congregation member have been in various ministries, including education, administration, social service, mission service in El Salvador, healthcare governance, and now as the Sister of St. Joseph of Peace congregational lead. In addition to this 7-word phrase, Sister Andrea has given us at Peace Health many other phrases. We call them Sister Andreaisms. Here are but a few examples. Loving God, source of all life, we come to you full of hope and joy. We do not have a wealth problem. We have a distribution of resources problem. Grab hold of our faith in the spirit of wisdom. I don't think that calculation is correct. And again, I don't think that calculation is correct. I would now like to share a video with you to hear Sister Andrea in her own words as she celebrates the ministry of Peace Health.
It's been said that what we do each day defines us. It's the way we choose to live our lives. When there is pain, when others are in need, and when the time comes to work together. At Peace Health, the work we do, it's more than just a duty. It's more than relieving pain and suffering. Our work is about life. And we all know that life is all about living. We are there in the difficult moments and the celebrations, the moments of fear and the tears of relief. Doctors, nurses, technicians, and support staff. All across the Northwest, from Bellingham to Florence, from Eugene to Vancouver, in local communities, offering warm, healing facilities, cutting-edge technology, and the best caregivers in the region. We are Peace Health. We are your neighbors, your friends, your family. because we all have the right to be healed, to live life.
You have to introduce me.
Please keep Sister Andrea in your prayers and thoughts as she celebrates her Jubilee year. It is now my pleasure to introduce Peace Health President and CEO, Liz Dunn.
Good afternoon. It's great to be with you all today. Thank you, Steve, for acknowledging Sister Andrea and the extraordinary impact she's had on Peace Health and so many of us gathered here today. Let me add my own personal congratulations to Sister Andrea on her momentous 60th Jubilee and all that she has accomplished. Sister Andrea, you truly embody the legacy and the spirit of the founding sisters, offering healing, compassion, wisdom, and joy to me and to countless others. Thank you. In times like these, it's simply wonderful to have a person like Sister Andrea to celebrate. We are so thankful and blessed to have you as part of our Peace Health family. As Steve shared, Sister Andrea is beloved for many things, including her great sayings, or as we call them, Sister Andreisms. Today, one in particular comes to mind. Not too long ago, Sister Andrea spoke to Peace Health's burning ball of accountability, how we have this unwavering responsibility to protect and propel our mission and our legacy by relentlessly caring for all. And more often than not, this burning ball of accountability means we have to make tough decisions, decisions that may not always be popular with all, but stay true to our mission and our values. Sister Andrea and the Sisters of St. Joseph of Peace model the courage, discipline, and servant leadership required to make hard decisions in service to the common good. Today, as we face the fifth wave of COVID-19, we draw on their strengths and their example as we relentlessly and courageously care for our patients, caregivers, and our communities. As you know, Peace Health took a bold step earlier this month when we announced our COVID vaccine requirement. We did this before other health systems and before state governments announced their mandates. Upon completion of our ethical discernment, it became clear our mission, vision, and values called us to act. I feel strongly that it was the right decision, and I am proud that Peace Health was at the forefront. I commit to you that we will continue to do everything within our power to keep our patients, caregivers, and the community safe, and always live up to our mission. This is our burning ball of accountability. Despite the disapproval of some, but thanks to your hard work to inform and support and encourage your unvaccinated folks on your teams, I am heartened by the response of our caregivers. As of this morning, 1,600 caregivers have updated their vaccination status, putting us at 87% across the system. This is a great step in the right direction. Unfortunately, the latest data indicates we must do more. In the last week, after considerable deliberation, we have decided to further strengthen our stance. After October 15th, all patient care at Peace Health will be delivered from vaccinated caregivers. For many of you, I know this new requirement puts additional stress on your teams. And in some cases, we're losing talented caregivers. But the fact is, The transmission risk from the unvaccinated is simply too great. Since August 3rd, the public health emergency has even become more acute. Peace Health has set multiple records for COVID-19 inpatient admissions, exceeding the peaks of this past January. And you'll hear from Richard and Doctors Cook and Pelz. Sadly, the Delta variant continues to drive up our volumes. Each day is a new record high. It's a similar picture across all of our communities and sadly, across the entire country. And the latest modeling doesn't show things letting up for several more weeks. While the fifth wave is challenging on our resources and our people, as Richard will share, we have a solid foundation in place and we are operationally ready. I know it's been an extraordinarily challenging time, one that's demanded so much of you as leaders and your teams, time and time again. But we've got this. I have no doubt our team, all of us here today, will rise to the occasion yet again, as we've done throughout the past 17 months. I have full confidence we'll continue our stellar work in service to the common good in our mission, just as the founding sisters would. We stand on their shoulders. We find strength in their strength. As we find ourselves deep in the trenches yet again, I will ask for your help in continuing to support our extraordinary caregivers and one another. Our caregivers are exhausted, yet dedicated heroes, and they deserve our praise and appreciation. So please keep it up. Please continue to support your team and them, and embrace a pro-vaccine culture. Viruses like COVID-19 are here to stay. If we are to preserve personal and community health, vaccines are undoubtedly our best protection. And you need to continue to be vital ambassadors. Before I finish, I wanted to take a moment to express my gratitude. I feel blessed every day to work with such an immensely talented group of people. This leadership team, each of you are exceptional. We're in this position of strength because of you. You are Peace Health. I want to leave you with inspiring words from Dr. Rick Padgett, System Medical Director of the Cardiovascular Services in Oregon. The reflection he shared with his fellow colleagues rings true for me when thinking of this team and our 16,000 amazing caregivers. Dr. Padgett wrote, "When I see you comforting a scared patient, I am proud. When I hear you talking to a confused patient on the phone, I am proud. When I see you all going about your job with a steely-eyed determination, but still a smile on your face, I am proud. I'm proud of you, but mostly I'm proud to work with you." And he ends with, "We will get through this challenge, as we always do, together." With that, I'll turn it over to Richard.
Thanks very much, Liz. Appreciate that. I just want to take a moment before I start to acknowledge where we're at as a health system currently with the patient volume that we're all managing. And Dr. Cook will share here in a few minutes where we're at in terms of COVID surge, but just want to acknowledge the incredible hard work and dedication that's happening right now at this moment in all of our hospitals who are facing unprecedented challenges with volume. And I know, again, you will rise to that challenge. Usually you hear from me about our current state and our ongoing response. And this time, Dr. Cook will be providing that update. Today, I want to share what we've learned and how we're prepared for this current wave of COVID in all of our communities. The danger posed by the current COVID-19 variant is really a public health emergency that affects everyone. The COVID-19 variant circulating in our community is more dangerous and it's more deadly. Unfortunately, we're seeing young children, and in some cases infants and pregnant women, and otherwise healthy and strong individuals who are falling ill with COVID-19. While most of our hospitalized inpatients with COVID are unvaccinated, we are seeing some breakthrough cases in vaccinated individuals as well, most often those with underlying health conditions. This puts a significant strain on our resources and adds to the stress of our clinicians. So much that at times it may feel like there is no end. While it may not feel like it in the moment, particularly today, we are prepared and more qualified to handle this wave than before, because we've learned from the past and we've prepared for the future. As Liz said, and as we often say to one another, we've got this. While this fifth wave is not what anyone wanted, there is so much to be proud of, and there is hope on the horizon. We have a solid foundation, we've done collaborative planning, and we're an agile team. Over the past 18 months, we have built and refined structures and systems to address COVID. For example, we have enhanced our data analytics capabilities to better inform and advance our decisions. Our data insights also help us accelerate our operational improvements, including capacity and staffing management, and our efforts around length of stay. We are ready to support the continued surge, while also addressing the healthcare needs of our non-COVID patients. We have modified caseloads, pulled back on procedures that can be safely delayed as our COVID volumes swell. Our clinical teams take great care to ensure that each non-emergent case is reviewed thoroughly prior to any postponement. And I continue to be inspired by the heart and the dedication of the leaders and the frontline caregivers. The next 4 weeks will certainly be a test for us. And I'm confident in our ability to care for our patients with the same level of care and compassion that has gotten us through this last year and a half. CDC guidance, FDA approvals, state directives, they're all being monitored closely by our teams. And we will continue to adjust, modify, adapt, and be agile to plan for what's come. As Liz shared, we are leading the way, doing what's right for our communities. Our mission has never been more relevant or more meaningful. And finally, I want to express my most profound appreciation to everyone for your continued support and dedication. We are incredibly thankful to the leaders, caregivers, providers, frontline, and support teams for ensuring every patient receives safe and compassionate care here at PeaceHealth. With that, I'll turn it over to Dr. Doug Cook, our Chief Physician Executive. Doug.
Great. Thank you, Richard. And you are correct. The current variant in our communities is more transmissible, and it has certainly proven itself to be deadly. What's new in this fifth wave is that this is really an epidemic of the unvaccinated. Younger, at times previously healthy individuals are all part of our hospital COVID census today. Since February 1st, more than 92% of the COVID-19 hospitalizations and deaths in the state of Washington were individuals who are not fully vaccinated. So I want to go through some numbers with you. If you'll go ahead and advance to my first slide there. You all are working in the midst of a public health emergency. As of this morning, we had 251 COVID-19 patients across the system. Last week, it was only 203. 2 weeks ago, 160. You can see how these numbers are accelerating. And perhaps these numbers don't look all that dramatic, but having one diagnosis occupies such a significant percentage of our inpatient beds puts pressure on non-COVID operations and the other care we're trying to provide. It's a huge strain on our hospitals, on the staff, on administrative bandwidth. And it's a strain on our emotional resilience. But we're going to manage through this. We've had an 18-month run-up to prepare ourselves. Go ahead and advance me to the next slide. Because good planning requires good forecasting. And what you have here, what I'm showing in this slide, is two superimposed charts. The one that has the red and black lines are from Dr. Peter Graven at OHSU. The peach lines are actually representing our hospital census at PeaceHealth. Dr. Graven's model has been a very accurate forecast model for us. And as you can see, we've not yet peaked. We're still 1 to 2 weeks away from the estimated top of this fifth wave of COVID. If you go to the next slide. What we're expecting is to see a COVID census of around 300 across the total of PeaceHealth. We'll see days of 100 to 130 patients in both the Columbia and the Oregon networks. This doubles the previous peak in the third wave. It's 3 times higher than the fourth wave that we had in April and May. And it's important to remember this is not just a PeaceHealth issue. The same high census and strain on resources is occurring elsewhere across the country and certainly in the Pacific Northwest. Examples, in Southern Oregon, we've had calls out from those health systems asking for us to provide ventilators and other oxygen delivery equipment. Last week, we received a COVID transfer from Northern California. Things like that that are just unprecedented in our healthcare system. This is hard work. You know this as well as I do. It's frustrating. We all know a component of what we're seeing today is because some folks were reluctant to get a vaccination. And that adds to the compassion fatigue. It's a real phenomenon. But you, our leaders, can make a difference. The continual rounding that you're doing, expressing appreciation, concern, helping folks appeal to their sense of calling, reminding folks why they're in healthcare to really care. So as I talk about our preparation, I think it's easiest for me to think about this and our surge capacity planning, planning in sort of 3 lanes: space, people, and materials. So let me start with space. The new volumes are primarily being managed in space that's freed up by reducing elective surgical volume. That allows us to use post-op surgical beds for medical patients, recovery areas, short stay surgery areas for COVID patients. But there's also a lot of creativity at play, of which all of you are contributing. Each hospital has some very innovative plans to flex into sleep lab space, cath lab recovery space, infusion centers, really wherever we can find the space, we'll use it. And then people. As you all know, we already had a very tight labor market. Now we add to that high COVID census and increased work, and the future inability to use those unvaccinated caregivers in the workforce. All those factors are converging today. Our solutions are multifactorial, ongoing recruitment, talent acquisition efforts, overtime, reassigning staff, and also the use of temporary and locums replacement staffing. As you know, we surveyed all our caregivers to understand the intentions of compliance with the vaccine requirement and to generate really accurate staffing gap predictions. And then we're out contracting for the needed personnel with staffing solution firms. And lastly, I'll talk about materials. You know, when we look at our PPE dashboard, we have adequate stock on hand today. And we'll continue to manage this supply-demand equation over the next few weeks. For instance, we doubled recently the order quantities for PCR testing because we knew the testing was going up. We'll be watching drug supplies closely. Really, the only shortage we've dealt with thus far was around some of the new biologic monoclonal drugs. We've also stood up COVID monoclonal infusion sites outside of the hospital, so we don't use the hospital footprint for that therapy. So that's a little bit about space, people, and materials. But I think in addition to thinking about it as fixed numbers, we need to do things differently. We need to speed the throughput with our existing resources. So if you go to that next slide, because we can manage more people with the same fixed resources if we can reduce the time or the length of stay that a patient is in our facility. Now, this is work that we needed to do anyway to bridge the time between now and when additional beds come online with master facility plans. And it's also work that we had to do to ensure the financial stability going forward of our organization. So in a sense, we're never going to waste a crisis. And this is forcing us to do the right work that we had to do anyway. So there are a variety of efforts happening here. We have some new analytic tools that look at capacity. We're optimizing care management teams. We're doing important work in the post-acute and the ambulatory arenas, which will reduce readmissions and reduce unnecessary first admissions. With the length of stay opportunities, I tend to think of those in 3 categories: those observation patients, the typical length of stay, 3 to 8 days, and then those long length of stay. And where we think the biggest gains will be had are in those first 2 categories, really ensuring our obs patients, we can get them out in less than 24 hours. And in that second category, if we can just shave 1 or 2 days off that mid-range length of stay, we'll do a lot for our capacity. Many of these efforts require us to think differently, to be engaged differently, especially for our primary care physicians and our hospitalists. It means really thinking about their work differently. We've been engaging them in these efforts. So I'm about ready to turn it over to Dr. Pelz. I guess my last comment would be that we are nearly there. 4 weeks from now, this wave of COVID-19 will be in a steep decline and things will be improving. But these next days and weeks will really test our resolve and our resilience. This is where we need you all to support one another. You all have my utmost admiration and appreciation. You're doing tremendous work, and so I thank you. And with that, I will turn it over to Dr. Pelz, who's going to walk us through some of the science of what we can look forward to.
Thanks very much, Dr. Cook. I want to spend a few minutes talking about some kind of hot topics in COVID, and pretty much every time I give a talk about COVID, I preface it by saying that I have no doubt that there's some paper out there that I didn't happen to notice, and I'm sure that you know a little tidbit of information that I didn't happen to catch in the review I've done. But with that caveat ahead of time, why don't you advance to the next slide, please? So I want to talk a little bit about the information surrounding the possible need for getting boosters. Now, I'm referring to boosters for people getting a shot due to waning immunity, not due to immunocompromising illness. There are a lot of considerations to take into account when you're thinking about whether somebody should get a booster because of waning immunity. The vaccines that were given earlier to people, in other words, the people that have been vaccinated longer ago, those folks commonly were nursing home residents who may have underlying illnesses that may make them respond less well to the vaccine and give the appearance that the vaccine is losing efficacy. The other thing is that the people that were vaccinated early on were healthcare workers. And you may see an appearance of waning efficacy in that population because they're so heavily exposed. The other thing is that it's really inseparable between the variants and the potential for waning of the immunity from the vaccination, because as time goes on, we're seeing more of these variants, and they're often there's concerns that they may be resistant to immunity from the variant, and the opposite is true there as well. There are studies out that show declines in antibody levels, but those might not really reflect a fall in your actual protection from COVID, because there are aspects of the immune response to a vaccine that are not reflected in the antibody levels. Waning immunity may be a phenomenon that differs from vaccine to vaccine, and I think it's important to realize that the American Committee of Immunization Practices has not yet reviewed the data or even recommended that boosters be given to people outside of the category of the immunocompromised patient. Next slide, please. So a few more thoughts around this. The data for showing decreased efficacy or waning immunity to these vaccines tends to be more striking when you're just looking at infections rather than looking at severe infections that could lead to hospitalization or death. The other thing to keep in mind is that if you hear reports that cite an increased absolute number of breakthrough cases, a lot of that is going to be driven by the fact that there are simply more people out there that have been vaccinated. So if 100% of the population were vaccinated, then every case would be a breakthrough case. I just want to reveal a personal bias that I have, is that it's often hard for me to pay attention to data that seems to show waning vaccine efficacy. I think I have to struggle against that in reviewing these studies. And the final point regarding booster doses is that the World Health Organization still is recommending against boosters being given. And a lot of this is because of their global view of the problem. You know, if India had a high vaccination rate 6 months ago, we may not be dealing with the Delta variant that we're seeing right now. Next slide, please. So let's dive into a review of some of the literature about whether immunity wanes or not. And as you're probably all aware, Israel has one of the highest vaccine rates in the world. They've predominantly used the Pfizer vaccine, which is one of the vaccines that Peace Health uses. They looked at people that were vaccinated either in January or February and compared them to people vaccinated in March and April, then looked to see if they developed COVID in the period between June and the end of July. And they found that there was a 53% higher risk of COVID in the people that were vaccinated early on. Now they're looking at hospitalization, they're looking at infection, not hospitalization or death. So this study doesn't really speak to whether the vaccine has lost any ability to prevent severe infections like the ones that are filling up the ICU at Riverbend right now. Another study out of Israel by an author named Israel again, looking at infection rather than hospitalization or death, looked at people that had been vaccinated more or less than 146 days ago in people over 60 years old, and they found a threefold increased risk of infection in the people that had been vaccinated more than 146 days ago. NPR recently reported a study out of Israel that says that half of their severe infections are in fully vaccinated people, but they're still seeing a good protective effect from the vaccine with a 9-fold higher risk among the unvaccinated. Next slide, please. And finally, the data that Pfizer submitted to the FDA in support of its request for an indication for a booster vaccine. They looked at vaccine efficacy in the first 2 months after vaccination as compared to months 4 to 6 after vaccination, and they saw a fall in efficacy from 96% down to 83%. Now, Moderna, their internal data is still citing about a 90% efficacy after 6 months. Next slide, please. These data are out of New York State from a gigantic state registry with 10 million vaccinated people and 3 million or so unvaccinated people. They compared those, and I would draw your attention to the top dashed line in both of the panels on the slide. The one on the left looks at all infections and does seem to show a steady decline in efficacy or vaccine effectiveness over the last few months that the study covered. However, if you look at the other panel, looking at rates of hospitalization, you really don't see much in the way of a decline in efficacy in terms of prevention of hospitalization. So these data would lead me to believe that the vaccine remains pretty efficacious in terms of preventing the severe complications of COVID. Next slide, please. Mayo Clinic has looked at some of one of their data sets comparing vaccinated people to unvaccinated to those vaccinated with either Pfizer in the blue or Moderna in the peach color there. And they showed a difference in vaccine efficacy between Pfizer and Moderna, with Moderna performing a little bit better, a lower rate of breakthrough infections. Both were dramatically better, of course, than the unvaccinated population. For hospitalization, from comparing July to January, they found that the vaccine efficacy of Moderna and Pfizer were 81%, 75%, and for the later period, it was 76% and 42%. So some evidence of a slow decline in efficacy for both vaccines, but more pronounced for Pfizer. Next slide, please. This list I won't go into in detail, but this describes the indications for a booster dose of vaccine in patients with compromised immune systems. And this list of people is really those with severe and pervasive, long-standing immune compromise. The indication for HIV is such that it probably wouldn't include any of the HIV patients that I take care of right now because they have reconstituted and stable immune systems with current therapy. Next slide, please. So I want to talk a little bit about the Delta variant. When I looked at the Oregon Health Association administration data from a couple of months ago, we didn't have any Delta variant, and now it's over 90% of the cases in Washington and Oregon. There's some studies that show that vaccine efficacy may be a little bit lower, and when they do in vitro studies looking at the ability of serum from vaccinated patients to neutralize the virus, they found a moderate decrease in immunity in those in vitro studies. There's a study out of China that shows with the Delta variant, there is about 1,000-fold more viral particles in the nasopharynx of an infected patient with Delta than there was with the Alpha strain or the United Kingdom variant. So that probably means that you don't need to be in the company of somebody with COVID for as long or as close to them to risk being infected. And it, as we've heard, it shows that the Delta variant is quite a bit more contagious. Now, the measurement of contagiousness that we use is the R0, the R sub-zero value that you see below, and that's an illustration of the effect of a different R0 or R sub-zero. So influenza typically is described as an R0 of 2, which means that if I'm infected with flu, I will infect 2 people. They'll infect 4 people, and those will infect 8 people. So with 3 generations, you go from 1 person to 8 people. Delta variant has an R0 of about 6, which means that if I have Delta variant COVID, I'll infect 6 people who will infect 36 people who will infect 216. And you can see how rapidly that curve will rise and how different that will be for Delta as compared to the old Wuhan virus or to influenza. Next slide, please. So let's take a look at some data on vaccine effectiveness. There was a large database that was published in the New England Journal of Medicine earlier this month, and they showed a 93% vaccine effectiveness against the Alpha variant, but only about 88% against the Delta variant. Single dose had a lower efficacy for both of these variants. Now, they're not looking at hospitalizations or death. They're only looking at symptomatic infection. The AstraZeneca vaccine, which is not available for use in the United States, performed somewhat less well than did Pfizer in that study. There's another study with out of the MMWR with almost 15,000 U.S. nursing homes. Again, a very large pool of patients that they're looking at. And they looked at time periods before Delta, an intermediate or overlap period, and a period where Delta was the predominant variant. In the pre-Delta era, the vaccine effectiveness for Pfizer was 74%, for Moderna about the same. But in the Delta period, it was only about 50% for both of those vaccines. Now, this study, in contrast to the Mayo study, showed Pfizer performing just slightly better than the Moderna vaccine. This is just data on infection, not on hospitalization or death. Next slide, please. And I was asked to mention briefly the Lambda variant, which may be the next variant on the horizon. This has become the predominant variant in Chile, Argentina, and Colombia, as you see on the map there. The rest of South America is seeing other variants like the UK variant or the Brazil variant. This is considered a variant of interest, whereas the Delta variant is a variant of concern by the WHO classification. It does seem to be capable of causing clusters so far. It is in a very small minority of cases in the United States, and last I checked, Washington and Alaska had not seen any cases, and Oregon only had 5 of these as of last week. Next slide, please. I wanted to touch on pediatric vaccination briefly. As I'm sure you're all aware, there's vaccine eligibility currently for children 12 years and older. The Pfizer vaccine is still under an emergency use authorization for the younger people, whereas it already has full approval for adults. The American Academy of Pediatrics reports that there have been 346 deaths due to COVID. And that's their best estimate, but more than 4 million people, kids have tested positive for this. So although children don't really get as sick, there still is a significant burden of morbidity among the very young. And I'm very concerned about what's going to happen to the epidemiology of COVID as kids go back to school. There are vaccine trials underway for the younger group of kids between ages 5 and 11. Pfizer uses a dose, a third of that they give to adults, and they're hoping to submit data for an EUA by the end of September. Next slide, please. I was asked to prognosticate a little bit about influenza. Typically, the influenza season in the Northern Hemisphere in the winter is pretty well predicted by the influenza season in the Southern Hemisphere. This year in the Southern Hemisphere, the World Health Organization in a surveillance program they have in Australia reported only 1 positive specimen in the first 23 weeks in Australia. And the Australia Department of Health describes their influenza levels still at historic lows. The Pan American Health Organization also says that South American influenza activity is quite low. So if I had to predict, we're unlikely to see very much flu activity, just as was the case last year. Next slide, please. Okay, and with that, I'd like to turn over to Ron Saxton. Thank you.
Well, thank you for the excellent updates and sobering. We really appreciate the great work all our clinical leadership is doing. I'm going to touch just on a couple government actions here, and there are a lot of them we could talk about. I'm just going to talk about 2 of them: mandates and waivers. But I want to start with a couple observations. Those of us who are not the clinical people here, we're here to support the clinical efforts. That's why we're here. And it's always a team effort, but I don't think it's ever been as much of a team effort as it is right now. I mean, the frequency with which, the lawyers, the government affairs, the employee health, all the people are interacting and working on this. It's gone from, periodic to daily and even hourly. So I want to commend all of you out there who are so involved in helping us stay on top of, the changing rules, what needs to be done, and how we support our clinical efforts. The other observation I want to make is that there's an awful lot of government action going on, the reason I'm talking here, and some of it, a lot of it, it's probably all of it, is aimed at making us more effective, but all of you understand it doesn't make it easier. A lot of it, even we'd call waivers, makes for more work. So let me just hit a couple of them. On the mandate side, we've dealt here for some time with masking mandates. They, on, off, on again, but our states have required masking in a variety of settings, and right now require masking in almost all settings. That's Oregon and Washington. Alaska does not have a masking mandate. Now we're looking at the mandates around vaccination. And as Liz talked about, PeaceHealth moved ahead with this aggressively on our own. Oregon and Washington have now taken similar steps. Again, Alaska has not. But Washington Governor Inslee moved aggressively to impose mandates on all healthcare workers, regardless of what kind of worker or whether on what site. In Oregon, Governor Brown a little more reluctant to do that, and I'm proud that PeaceHealth, many of you, played a real role in pushing that and helping push her to come forward with an aggressive mandate. So both of our primary states now have strong mandates for healthcare workers around both masking, but especially now around vaccination, with testing options not so much available and so forth. I won't talk about the booster vaccine other than just to note that we've had two regulatory actions here that are important. One is the approval of the vaccine, the first vaccine, the Pfizer vaccine, removing the emergency status, which has the effect of removing a number of the objections that people have had. And the second is that, the noting that some patients will have booster vaccines, and Dr. Pelz talked about that. Wendy, let's go to the next slide on waivers. From the beginning of the pandemic, it's been very, very difficult for hospitals to do anything that looked like business as usual. And so a year ago, we're spending time talking about all the different waivers we were working to obtain that would let us, stretch our resources, use facilities, use people, use, equipment differently. And many of those waivers were put in place. Today, most of those remain in effect. Again, Alaska is the odd man out here, doesn't, but Oregon, Washington, and the federal waivers are basically all still in place. And so alternative uses of care sites, the cohorting, telemedicine has been a big one where we've got the waivers. So, but I want to note the waivers, they offer flexibility. They don't let us ignore laws, and we have to be very careful. And it's one of the efforts we're so involved in is, the waivers just change the rules. We still have to follow the rules. And so it's so important that everyone understand what the new rules are and make sure that we're able to follow them. It's also important to remember that they differ state by state. I noted here Alaska has some different rules, but Oregon and Washington rules are also very different in some ways. And so again, rules are different. Don't just rely on what you've known from the past. Make sure we're paying attention to what's out there now. So, the flexibility, the telemedicine, the waivers, and again, I'll just make the final point. I don't think the burden on our teams have been reduced by all of this, the waivers and so forth. I think they've been increased. And so we appreciate that it's hard work because of the clinical struggle we're facing. It's hard work because we're an incredibly heavily regulated industry and the rules are changing, and we have to pay attention to those. But back where I started, I'm so proud of everybody as a team. I mean, everybody pulling together here to make sure that our clinical people have what they need, and all of us who support the clinical effort doing everything we can to help make it happen. So thank you all. And Richard, I think I hand it back to you.
Thanks, Ron. Appreciate that. And just want to also thank Dr. Cook and Dr. Pelz for sharing all that great information with us. As I said earlier, this is a difficult time for us, particularly this week, as we've seen our peak census and I know how hard everybody's working in all of the networks. There's also a lot to be proud of, and hope is on the horizon. This wave will not last forever. As we've seen in the data, we are peaking in the next 10 days, and then we will see that peak crest and we will start to decline. Together, we're stronger, and together we will make it through this surge. We have about 4 weeks ahead of us of really difficult work, and then we will see that decline. I want to also say how much I admire our caregivers and our frontline staff. As a clinician who spent many years at the bedside, I see the challenges that everyone is facing every day, and I'm inspired by their ability to return and do it again and again, day after day. And thank you all as leaders for tirelessly working to ensure every patient receives safe and compassionate care here at Peace Health. I want to express my most profound appreciation for everyone for your continued support and dedication. Without you, we would not be able to fulfill our mission and our shared purpose. And finally, like Liz, I am also honored and proud to stand beside all of you shoulder to shoulder to advance this work. You're an incredible group of leaders who have the Peace Health mission in your heart and in your soul. Thanks very much, and I'll turn it over to Sarah.
Thanks, Richard. Thank you so much for joining us today from Liz and the senior leadership team. Thank you for dedicating this time with us today. Post-call, we'll send out this deck, we'll send out a recording of the call, and we also invite you to sign an e-card in honor of Sister Andrea. So with that, thank you, take care of yourselves, and be well.